Hello, my name is Martin Schoen, and I'm a assistant professor of medicine at St. Louis University, as well as the St. Louis Veterans Affairs Medical Center. I'm going to be talking today about outcomes and treatment differences between Black and non-Black patients based off of comorbidities in the Veterans Affairs Medical Network. We identified approximately 2,900 patients that were treated for multiple myeloma between 2006 and 2013. All of the patients in our cohort had to have initial treatment in the VA and had treatment within 6 months of diagnosis of multiple myeloma. We found that there was differences in the different comorbidities between Black and non-Black patients, and I do want to say that Black race was identified at registration by VA services. And so Black patients were identified as having renal disease approximately 11% higher than non-Black patients. But at the same time, they had improved measurements of renal function as measured by glomerular filtration rate. So there was a discrepancy in that Black patients actually had better renal function as measured by laboratory values as well as by the MDRD formula for glomerular filtration rate, but they were identified as having worse renal function based off of ICD-9 codes. Additionally, there were treatment differences between the two populations. Black patients were more likely to be treated with bortezomib, and they were less likely to be treated with lenalidomide. And this also is the same treatment pattern that is seen across all patients that have renal disease. In patients with renal disease, there was a 10 to 11% higher rate of treatment with bortezomib, and in patients with renal disease, there was a 10 to 11% decreased use of lenalidomide. And I did this study because we wanted to understand differences in treatment between Black and non-Black patients and understand how comorbidities play into those treatment decisions. And we feel that it's important for clinicians to recognize that there may be differences in how creatinine is measured and how glomerular filtration rate is shown in our laboratory values, and that clinicians should take into account the different aspects of race and glomerular filtration rate when deciding treatments for their patients.